I would like to now introduce Dr. Narasimhan, who is a postdoctoral fellow for the Center for Reproductive Health Research in the Southeast at Emory University. In 2019, she was awarded the Society for Family Planning Research Fund's Emerging Scholars and Family Planning Award. And Dr. Evans is an associate professor of global health and the Rowland School of Public Health at Emory University, focused on women's health and human rights. As an established trainer and teacher, she has touched over 19,000 learners from 171 countries. Welcome you both.
Thank you so much for that introduction, Joel. Hi, everybody. I'm excited to be here this afternoon to talk to you all about mine and Dr. Evans' project focused specifically on Georgia's abortion ban, HB 481. So, a little bit of background. Georgia's abortion ban was put forth in the legislature around March 2019, and it was championed by Ed Setzler along with 5 other representatives. Next slide. The study purpose really was that we wanted to understand the anti-abortion rhetoric used in the HB 481 legislative debate and community testimony. So legislative debate here, we're talking about what legislators said during discussion of the bill. And community testimony is what are the narratives that community members put forth in support of this bill. The impetus for this study really was frustration with looking at how abortion bans had proliferated across the United States. And we know, as discussed by all the previous panelists, that abortion bans have a negative effect on Georgia's most marginalized women. So we set forth, as people who had been part of this democratic process, to sort of document and systematically understand what were legislators saying in support of this bill. And this is what we found, which I think is, to some people, may be quite a shock and a frustration. We feel that the rhetoric put forth by legislators in support of HB 481 is really a form of reifying structural violence. And by that, I mean the increased marginalization through colorism, through racism, and within the legislative debate. And so how we divided these results up is we've said, okay, what were they saying? What were both the legislators and community members who were in support of this bill saying? And then how? So what is the tactic that they were using with this kind of rhetoric? And we found that the what was this focus on the idea of heartbeat. So as many of the people who have been following HB 481 know, that the pro-life term of choice is that this is a heartbeat bill. So the ban should be at the detection of a heartbeat, which sometimes is at 6 weeks, but could be earlier depending on if a physician deems that a heartbeat has been heard. This is not a biologically determined or a medically scientific or sound argument. So within the legislative debate, the legislators were pushing this heartbeat as a marker of life. The second and even more insidious what that we found was that they were they were putting forth an argument for creation of a new protected class of people. So using what we call equal protection arguments under the Constitution and saying that fetuses deserved the same equal protection as women of Georgia. And beyond that, we also saw that they wanted to expand the state sovereignty rights to protect fetal rights. So sometimes states expand laws beyond that of federal statutes in order to protect the people in their states. One really good example of this is California's emission laws. So California has higher standards of emission laws than the federal government requires. They believe that protects the environment of their state. Here, what legislators were discussing is that they needed to expand state sovereignty, so the rights of the states to decide beyond that of Roe v. Wade. And the states should also reclaim what is viability, and the new viability standard should be at heartbeat. The goal of this also, what in their rhetoric, was first to pass the legislation, which we know the legislation passed by an extremely slim margin, but was enjoined by the current challenge of Sister Song, the ACLU versus Kemp. And then finally, to move this up the court system to challenge Roe v. Wade. So now that I've given you a precursor to what people said, now I want to talk a little bit about the tactics. So the how. We saw that a lot of this rhetoric was used in purpose of something. So first, it was used in purpose of appropriation. So appropriating what we saw as progressive arguments, and I'm going to move us forward to Dr. Evans, who can cover some of the more deeply detailed portions of this results.
Thank you so much, Suba. If we can next move to the next slide, I do want to warn that what we're going to do here is share some direct quotes. And these data were gathered from the hearings that took place during the debate of HB 481. And so the text that you see in yellow print are some examples of some of the arguments that were made both by legislators and community members. So as Dr. Narasimhan said, this is a scaffolded argument that begins with the argument about heartbeat as being a measure of life and then personhood. And this is really the grounding and the footing upon which the entire argument about HB 481 sits, basically trying to define heartbeat as a marker of life. We'll move to the next slide and the next element. The second element in the arguments that were being made, principally by legislators, were to underscore the value and vulnerability of fetuses. And this was grounded in an argument that was highly offensive, particularly to those from the Black community, because this argument was grounded in the 14th Amendment. And for those that are familiar with this history, this was not the intent of the 14th Amendment, but the intent of that amendment was to ensure that classes of persons that had been discriminated against, in particular enslaved Africans, were given full legal recognition. And so what's happened here is that proponents of HB 481 are co-opting the 14th Amendment to advance this argument for an early abortion ban. Next slide. The third part of the argument is a states' rights argument. And basically the argument here is that the federal government should not be legislating, and particularly the courts should not be making decisions, and that these decisions should be left to states to legislate over their own provisions and protections. The argument here is that states are attempting to create protections that are above and beyond federal protections in this thinking. Next slide. And what we've got here, it's very difficult to see, but we do have this paper available online. And what we did is we actually did some fact checking for each of these arguments and the particular data points that were given or the evidence that was given by legislators in making their arguments. And we've fact checked that against reliable evidence sources that are known to be reliable sources of information. Next slide. And so the biggest takeaway from all of this work has to do with appropriation. And so we see that what proponents of HB 481 and other early abortion bans are doing is they're actually taking some of our arguments, progressive arguments, and using them against advocates in order to advance early abortion ban legislation by attempting to create a new protected class of persons, which are fetuses in utero. We're really grateful to the ACLU of Georgia and Sister Song and the other plaintiffs that are advancing the case against HB 481 in the courts. And I'll be happy to talk about that later on. Thanks so much.